Hi, do you want to learn about infusion, injection, and hydration CPT coding? Don't worry, I got you covered. This is Surya Johnson, your medical coding guide. Hi, in today's video, we'll see about infusion, injection, and hydration coding guidelines. There are so many coders out there still confused, still worried, still don't know what to do when it comes to infusion, injection, and hydration coding. Yes, there are guidelines, there are hierarchies to be followed, but I'm going to clearly explain you in detail in this video so it will be much helpful for you to derive the correct code. So before you're getting started, grab your notes so you'll not miss any of the important pro tips that I'm going to give in this video. By the end of this video, you'll all come to know what is infusion, injection, and hydration, what is the hierarchy to be followed while coding these CPT codes, and how time documentation plays a major role in deriving these codes. And also, I'll be giving you pro tips on how to choose the right code without making a mistake every time. You don't want to miss any of these important points, right? So watch this video till the end so it will be much useful for you. Before getting into the guidelines, the hierarchy, and all those toughest things, first let us know about what is infusion, injection, and hydration. So what is infusion? Infusion therapy is an alternative to oral treatment that entails the administration of drugs or medicine through a sterile catheter or needle. These are often introduced into a patient's vein and secured by a professional healthcare provider. So what they do is they secure this catheter or the needle in the patient's vein, and the administration of these drugs are done based on the earth's gravity. So it slowly drips down the infusion set by the help of the earth's gravity. That is infusions. The examples are banana bags, heparin infusion, nitroglycerin, antiemetics, antibiotics, etc. So in general, all the drugs that are given via this method are infusion. Next, we'll move on to injection. So what is injection? An injection is the act of administering a liquid, especially a drug, into a person's body using a needle and a syringe. There are many types of injections which are generally named after the body tissue the injection is administered into. If the injection is given in the subcutaneous area, then it is called subcutaneous injection. When it is given in the muscles, it is called intramuscular injection. When it is given in the vein, then it is called as intravenous injections. So what is hydration? Hydration therapy involves inserting an IV line into a vein in the patient's arm to administer fluids full of electrolytes. Typically, an administration of prepackaged fluids and/or electrolytes without drugs. So there is not drugs. The major difference between infusion and hydration is what is given, because both the methods are same. Both are relied on the gravity of the earth by the drip method. But the difference is the infusion uses the drugs. The hydration uses pre-packed fluids and or electrolytes without drugs. So there is no drugs involved in hydration therapy. Examples include normal saline, sodium chloride, dextrose 5% in water, dextrose in half normal saline, dextrose in half normal saline plus potassium. So what is an IV push? So an IV push injection rapidly delivers a single dose of medicine directly into the bloodstream and takes very little time. Next, we'll move on to the hierarchy. So what is hierarchy? Hierarchy means the order. In what order the coding should be done. So the first in the order are the chemotherapy drugs. So the chemotherapy infusion comes first, then the chemotherapy IV push falls next, later the chemotherapy injection. So first infusion, IV push, and injection. The second in the hierarchy is the therapeutic, prophylactic, or diagnostic drugs. So infusion, therapeutic, prophylactic, diagnostic infusion first. Next comes the therapeutic, prophylactic, or diagnostic push. Later the therapeutic, prophylactic, or diagnostic injection. So the last in the hierarchy is the hydration. So before choosing the CPTs for medication infusion, IV push, IV injection, hydration infusion, Please ask yourself these 4 questions for accurate coding. What is that? The first one is you should ask yourself, why is the patient here? So when you ask why is the patient here, it leads to the medical necessity, because without medical necessity, even the documentation for the injection, infusion, hydration is correct, you cannot proceed. There should be a reason for that administration. Like for example, the patient is receiving an antibiotic infusion or injection, then there should be a medical necessity met. And also if the patient is receiving a hydration infusion, obviously the patient should have been dehydrated or lost some fluids. So to compensate that, the doctor has ordered for the hydration infusion. The second question is, what did the patient receive? That is the solution what the patient is receiving. Is it an antibiotic or is it just a fluid, and whatever it is, you should know that one. Then only you can just go for the coding. The third one is, how was it given? It means the mode of administration. It is intramuscular or it is subcutaneous or is it in the intravenous? You should know how was it given. The last question here is, how long did it take? So this length of time will lead you into the correct coding. Next, before getting into the guidelines, we'll see about the CPT codes that are used in the injection, infusion and hydration coding. We want to look into the CPT codes, the description and all the keywords that are there that should be taken care of. Paying attention to all these keywords will definitely land you into the correct coding. So the first one in the list are the hydration codes. 96360. The description is intravenous infusion, hydration, initial 31 minutes to 1 hour. So the main keywords are hydration. So this code is used for the hydration infusion, initial, for the initial one. Then it gives a note like 31 minutes to 1 hour. So from 31 minutes to 1 hour, 96360 should be used. So the important notes to take in care are, do not report if performed as concurrent infusion service. So when this hydration is given along with another drug infusion in the same time, in this video I'll explain in detail about what are concurrent. So the second point to take care is, do not report hydration infusion of 30 minutes or less. So if the hydration infusion is given for 30 minutes or less than 30 minutes, like say 25 minutes, you cannot code that as separate CPT code, because the CPT description states it is 31 minutes to 1 hour. So you should always keenly look into the description and the footnotes that are available in the CPT book. Then we have the add-on code 96361. So the pro tip here for all the new coders out there, whenever you see a plus additional symbol before a CPT, it means the add-on CPT. So what to look into add-on CPT? Add-on CPTs cannot be given separately. It always needs a supporting initial or a parent CPT. So when there is a parent CPT or the initial CPT, then you can give this add-on code. Add-on CPTs cannot be given as a standalone codes. Okay, let's get into the description. So 96361 description is intravenous infusion, hydration, each additional hour. So it means the same for hydration therapy, but each additional hour. So what is each additional hour? We'll see the notes in this. So we'll report this for intervals of greater than 30 minutes beyond 1 hour increments. So if, for example, if the patient has received 1 hour already, a hydration is going, after that, like 1 hour 1 minute, you cannot code this code, because this also requires minimum 30 minutes of time to be coded. So the first point states, report for intervals of greater than 30 minutes beyond that 1 hour increment. That means if it's crossing 90 minutes, if it's going to 91 minutes, then this code should be coded. The second point, also report for secondary or subsequent service after a different initial service through the same IV access. As I said, this is an add-on code, so there should be an initial service. After that only we can code this code. The next CPTs are the drug infusions. So the first code is 96365. The description, intravenous infusion for therapy, prophylaxis or diagnosis. Initial up to 1 hour. So important note is, report for IV infusions of 16 to 90 minutes. This is the guideline. So it is up to 1 hour, right? But the time should be 16 to 90 minutes. Then only this 96365 is applicable. The add-on code plus 96366. The description is same intravenous infusion for therapy, prophylaxis, diagnosis each additional hour. So for each additional hour of the same drug, we'll code 96366. The important note here is report for intervals of greater than 30 minutes beyond 1 hour increment. So after the 1 hour increment, it should reach to again 30 minutes to be eligible for this 96366. So when it crosses 91 minutes, then you can go for 96366. The second one is because it's an add-on code, so it should always be given after a different initial service through the same IV access because it's an add-on code. The next add-on code for the therapy, prophylaxis or diagnostic intravenous infusion is plus 96367. It is for additional sequential infusion of a new drug. So the difference between 66 and 67 is 66 is for the same drug each additional hour, but 67 is for a new drug, not the same drug that is given the previous one. So the notes to taken care of are report in conjunction with 96365, 96374 if provided as secondary service after a different initial service is administered through the same IV access. Hope this is clear. The second point is report only once per sequential infusion of same infusate material. When there are multiple drugs mixed together in one bag, then it becomes an infusate mix. So because it's all different substances inserted into the single bag, you cannot code this code again and again for each of the substances that is mixed together. No, it should be all together as one mix. So the next add-on code for the therapy, prophylaxis or diagnostic intravenous infusion is 96368. So the difference is this one is a concurrent infusion. So the notes here is report only once per encounter. You should report 96368 only once, and what and all you can report this with, like along with 96365, 66, 96413, 96415 or 96416. This can be coded. The third one is used for infusions running at the same time via the same axis must be hung in separate bags. So the concurrent means the same time, at the same time two different infusions are hung but in a different bag. It's not as infusate mix. It's not an infusate mix. It's a different bag. We'll see about the IV injection or IV push. 96374. This is therapeutic, prophylactic or diagnostic injection or an IV push. Notes: report for initial push or therapeutic infusion less than 16 minutes. Then the add-on code 96375. It is for each additional sequential intravenous push of a new substance. So when there is a new substance, then it is 96375. So there is another add-on code 96376. That is therapeutic, prophylactic or diagnostic injection, each additional sequential IV push of the same substance. So the difference between 75 and 76 is 75 is a different substance, 76 is the same substance, same drug or the substance that is given as an IV push or IV injection. So the important note here is report for additional IV push of the same substance or drug at an interval of greater than 30 minutes. It means, like, if the same drug is given again as an IV push, there should be a time gap of 30 minutes for the same drug given in the initial and the same drug given after some time. So there should be a 30 minutes gap in between the same drug IV push or IV injection. If it is less than 30 minutes, then it is not eligible to be coded. You saw all these keywords like initial, sequential, concurrent, all those things, right? So we'll see what does that mean. So first, what is initial? The coding guidelines state there should be only one initial code per encounter unless two separate access sites are required or when there are multiple encounters during the same date of service. It means like There should be only one initial code. There cannot be multiple initial code. You cannot code an IV infusion initial code and an IV push initial code and a hydration initial code at the same time. No, there should be only one, and that is where the hierarchy comes to play. The second important point as initial is the CPT hierarchy is based on the instructional notes found in the CPT book. So you should always follow the instruction notes, like it will tell you the hierarchy in which the CPT should be coded. What does that mean? The third point states that the therapeutic infusion falls in the first in the hierarchy, the IV injection falls second, then the hydration infusions falls third. So it is always following the hierarchy. So a big no in initial service code is order of service delivery does not determine what is initial service. So you should always take care, like you should not code based on the order of the drug administration. Maybe sometimes the patient will receive a hydration infusion as the first one, and then an IV push, and then the doctor will order for an administration of an IV infusion. Because in this order, if you consider, the hydration CPT should be the initial code. No, you should not follow the order of the service delivery. You should always follow the hierarchy. So ask yourself to determine the initial code. So whenever you have a confusion to select an initial code, ask these three questions. First one, was there an infusion of 16 minutes or more? If yes, then 96365 should be coded. Next, if it is no, then the second question you should ask yourself, if there was no infusion, was there an IV injection? So if the answer is yes, then the initial code should be 96374. So if the answer for this question is no, then you should ask the other question. If there were no infusions or injections, was there a hydration of longer than 31 minutes? If your answer is yes, then hydration 96360 should be coded as the initial code. So this is how you can determine the initial CPT code. Next, in the initial service, we'll see the sequencing pattern, how it should be sequenced. As I already told, therapeutic infusion should be in the first, followed by IV injection or IV push, then the hydration infusion. So when there is a 96365 therapeutic infusion initial already given, you cannot give 96374 or 96360. In this case, you should always go for the additional 96375 or 96361 codes. Now we will move on to what is sequential infusion. So sequential is when multiple drugs are infused back to back or one after the other, like one drug is administered and after that is ended, then the second drug is started. After that, then the second one. So it is back to back or one after the other. Once completed, then the second one is starting, then the third one. So this is called sequential, in a sequence. So it must be a different drug through the same IV axis. So sequential drugs should be different, like the first drug, the second drug should be different from the first drug. The code here is 96367 that we already discussed. So what is concurrent infusion? So concurrent is when multiple therapeutic or diagnostic medications, but not hydration fluids, are infused simultaneously through separate bags through the same IV line. It means like there are multiple therapeutic diagnostic drugs or medications that are infused at the same time through the same IV line, but different ports. In that case, it is called as concurrent. So concurrent codes are not to be used for multiple drugs within the same bag. Like I said, there are multiple drugs. You cannot code each drug separately. It should be considered as a together infusate mix. So the code here is 96368 add-on code. Next, we'll move on to the important topic to be taken care of while coding infusion, injection and hydration services. That is time documentation. Yes, all these services are time-based codes, as you already saw the CPT code description. So drug administration codes are time-based. That is critical. Best practice here is to document the start and stop time for infusion. So there is a table here that explains the hour and what does it mean for in therapeutic infusion and hydration. So the first hour in therapeutic infusion means 16 to 90 minutes. For first hour of dehydration means 31 minutes to 90 minutes. So if the second hour for therapeutic infusion should be considered as 91 to 150 minutes, and for hydration same 91 to 150 minutes. So the third hour of the infusion for therapeutic will be 151 to 210 minutes. For hydration same 151 to 210 minutes. So the important notes here are therapeutic infusions less than 16 minutes should be considered as an IV push. Likewise, for hydration infusions less than 31 minutes are not acceptable or not reportable. The therapeutic infusion without stop or continuing time should be considered as an IV push. So there is a start time but there is no stop time, then you should consider that as an IV push. Then additional sequential IV push, same drug should have a time interval of 30 minutes that we already discussed in the CPT descriptions. We'll see some don'ts in the hydration infusion. When the purpose of the IV fluid is to keep open an IV line, then you cannot code hydration. Just to keep an IV line open, you cannot code the hydration CPT. You cannot code hydration CPT when the fluid is a vehicle in which a drug is administered. For example, a therapeutic drug is mixed with a normal saline or just a fluid to be administered, then it becomes a drug infusion administration and not a hydration infusion. Third one, you cannot code hydration when it is used to accommodate a therapeutic IV piggyback through the same IV axis. So when there is an IV piggyback, like there is already a hydration going on, and then through the same IV axis at the same time concurrently an IV drug is administered, then you cannot code the hydration. It becomes an IV infusion. So you cannot code an hydration CPT code when used for routine administration of IV fluids pre-post operatively while the patient is in NPO state without documentation of dehydration or loss of fluids. It means like you cannot code hydration CPT when it is given during the post or pre-operative stage, like when the patient will not have anything orally, right? So in this case, it is not for dehydration or loss of fluids. So there is no particular medical necessity for the administration. So we cannot code this separately. Now we have wrapped up the session, right? We'll see some extra points to boost up your knowledge. You should always double check these following points. The order and diagnosis for the service which supports the medical necessity. The name and dose of the drug or substance provided, because along with these CPT codes, you should always code the substance or the drug that is given. So if you are US based coding, you'll be coding HIPIX codes. If you are in UAE, that is Abu Dhabi Alain region, you'll be coding the Shafafia drug codes. And then you should always double check the route of administration, and at last the time of service provided, including the start and stop time for infusions. There are certain services that is included in the service codes, in these CPT service codes, which cannot be given or coded separately, like the use of local anesthetic, the IV start, access to the indwelling IV subcutaneous catheter or port, then line flush, routine supplies such as the tubing, syringes, then the monitoring, education or instruction given to the patients by the nurses or the doctors. These all services cannot be coded separately because these are all included in this CPT codes. Hope you all have a clear picture of hydration, infusion and injection CPT codes. We'll see some clinical examples. Example 1. Zofran IV push was given from 1:05 p.m. to 1:15 p.m. Then metronidazole infusion was given for 1:16 p.m. to 2 p.m. Then saline infusion was given from 2 p.m. to 3:30 p.m. So how can we code this one? This scenario will consider that all the medical necessity is met, so we'll focus on the CPT codes. So as I've already told, we'll ask the 3 questions. Was there an infusion given 16 minutes or more? Yes, there is. There is metronidazole infusion given 16 minutes and above. It's 1:16 p.m. to 2 p.m. So it's already 16 minutes and above, but it does not exceed 90 minutes. So we'll code 96365 for metronidazole infusion. So there is already an initial code. See, all the other codes will become a subsequent code because it's all given in the same IV access on the same day. So after infusion, there is an IV push. So Zofran IV push 1:05 to 1:15 p.m. So we'll code 96375. Then there's a saline infusion of 2:02 p.m. to 3:30 p.m. So it is coming around 88 minutes. It doesn't cross the 90 minutes. So we can code 96361 here. So in the second example, we'll see the same drug but different timings. In this case, Zofran IV push is given from 1:05 p.m. to 1:15 p.m. Then metronidazole infusion from 1:16 p.m. to 1:25 p.m. and saline infusion 2:02 p.m. to 2:30 p.m. So we will ask the first question. Was there an infusion greater than 16 minutes? No. There is an infusion, but it is not greater than 16 minutes. So it will go as IV push. So 96374 for metronidazole, and there is already another IV push, that is Zofran. So there is a one initial code 96374 for metronidazole. So all the other codes should be add-on codes. For Zofran IV push, we'll be coding 96375 because it is different drug. Then we have saline infusion here, but this saline infusion is less than 31 minutes, so it cannot be coded and it should not be reported. So the final code is 96374 and 96375. The third example here is Zofran IV push given from 1:05 p.m. to 1:15 p.m. Metronidazole infusion from 1:16 p.m. to 2 p.m. Saline infusion from 2:02 p.m. to 3:30 p.m. Ascorbic acid IV infusion from 2:02 p.m. to 3:30 p.m. Then Zofran IV push from 3:30 p.m. to 3:42 p.m. So as always, let's ask the first question. Was there a drug infusion greater than 16 minutes? Yes, there is. Metronidazole infusion is greater than 16 minutes. It is 96365. There is already an initial code we selected, so all other codes will fall as an add-on codes because it's all given on the same line on the same day. So we'll check the next IV push. That is Zofran IV push given from 1:05 to 1:15 p.m. So we'll give the add-on code for IV push 96375. Then we have the ascorbic acid IV from 2:02 p.m. to 3:30 p.m. So we'll be coding this one as 96367. Then comes the saline infusion. In this case, we will not code saline infusion as 96361 separately. The reason is it was given at the same timing of the ascorbic acid. You can see from the timing, saline infusion and ascorbic acid infusion are given from 2:02 p.m. to 3:30 p.m. So it is concurrently given. So when there is a drug administration concurrent to a hydration infusion administration, then we can code only the drug administration code. So we'll code only 96367 here. Then for the second Zofran IV push from 3:30 p.m. we'll code 96376. There is a time interval from the first Zofran IV push and to the second Zofran IV push. If it is less than 30 minutes, we cannot code. So in this case, we can code the 96376 for the additional Zofran IV push given. Hope you all have a clear picture about infusion, injection and hydration codes, right? Let's assess how far you understood. First question, paracetamol infusion 8 a.m. to 8:12 a.m. Scarpinal IV in 200 ml normal saline from 8:15 a.m. to 9:30 a.m. Zofran IV infusion. Start time is 9:45 a.m. You're right. We'll see the rationale in this. So we'll ask the first question. Was there an infusion greater than 16 minutes? Yes, there is. The Scarpinal IV in 200 ml normal saline is from 8:15 to 9:30 a.m. We'll consider this as a drug infusion. So for this, we'll code 96365. So all the other codes will become the add-on codes. We have paracetamol infusion from 8 a.m. to 8:12 p.m. but it is less than 16 minutes, so we should consider this as an IV push. so it is 96375. There's a Zofran IV infusion from 9:45 a.m. but there is no end time, so we should consider this as well as an IV push. So there is 96375 into 2. So we'll see the next example. Here the same paracetamol infusion from 8 a.m. to 8:22 a.m. Scorpinal IV push from 8:23 a.m. to 8:35 a.m. Another scorpinal IV push from 8:40 a.m. to 8:52 a.m. Then there is a normal saline from 9:15 a.m. to 11 a.m. You're right. We'll just see the rationale for this codes. Was there an infusion greater than 16 minutes? Yes, there is. The paracetamol infusion is greater than 16 minutes, so it will be 96365. So we already have the initial code. So all other codes will be the additional codes, add-on codes, right? So the next one is there is a scorpinal IV push from 8:23 to 8:35 a.m. So it will be 96375. There is another scorpinal IV push from 8:40 to 8:52 a.m. but we cannot code this one because the same drugs should have interval period of 30 minutes. In this, that criteria is not met. So we'll code only one scorpinal IV push in this scenario. The normal saline is greater than 90 minutes. So we'll code 96361 into 2. Wow, so you all answered all the questions right. If you didn't get those questions right, don't worry, just keep trying. Practice makes you perfect, right? If you have any questions to ask, any queries or clarifications needed, please put it in the comment box below so I can answer them based on the CPT coding guidelines. If you found this video to be useful, please hit the like button. It will really mean a lot to me, and please share with your friends, especially your coding friends, so it will be much useful for them as well as it was useful to you. If you have not yet subscribed, please subscribe and hit the notification icon so you'll not miss any of my future videos. Keep watching. This is Surya Johnson, your medical coding guide.